So briefly, I'm Cyzel. I'm one of the RCN Southeast Student Committee members, also a second year student at the University of Winchester. So it's my first time hosting, so we'll see what happens and how this goes. For now, if I can get just the speakers for today to introduce themselves, and then we can delve into the interview. So can I ask Brian to introduce himself first, please?
Thanks, Susan. Good evening, everyone. I'm Brian Webster Henderson. I'm Deputy Vice-Chancellor at the University of Cumbria, a Professor of Nursing by background. So my clinical career is mental health and adult nursing. And I'm also Chair of the Council of Deans of Health, which is an organisation that represents 100 universities in the UK who provide nursing, midwifery or allied health education and research. So nice to see everyone.
Amazing. And then James, over to you.
Thank you, Cyzel. I'm James Savage. I'm a third year student nurse studying mental health from Liverpool John Moores University. I'm the Royal College of Nursing Student Committee member for North West England and Student Quality Ambassador with Health Education England. I worked throughout the pandemic, first in a private care home in Northern Ireland and then within the NHS, volunteering as a student in England. And hopefully I can provide some relevant information as we go through.
Amazing. Thank you, James. So if I may, I will start with the questions with Brian, if that's all right. So as we know, we're talking about COVID. I can't remember what was my very first moment when I realized COVID was here. So do you remember what was your very first memory of COVID, or how did you know that we were going to a pandemic?
I'm not sure I remember my first memory, if I'm honest. I've got bits and pieces of memory. So like everyone else, I think I remember around the January before we went into the March lockdown, I've seen news media reports from China. And I started to look on the World Health Organization site and realized very quickly that this was something quite different. And then February time, as we'd seen the spread in China, it was going to be quite obvious that this was going to travel, this virus, with movement and with people, etc. And I started to think about what is the impact going to be on the UK, and then was approached by Chief Nurse and other colleagues in health education in England to say, you know, heads up, we think this is going to be quite big, we need to start thinking now. So had a little bit of pre-warning around what we might need to do in healthcare with students and what we might not need to do. So started generally thinking, but didn't really, if I'm honest, didn't really have that insight into where we are now and how kind of catastrophic this was going to be in the UK. So early warning signs from the media, early discussions with government and Health Education England, and then kind of a bit of digging around on the web really with World Health Organization.
That's amazing, and I can really imagine how it has been for you, like, because you were doing Council of Deans as well as worried about the university as well. So within your organizations, I know you had a very split role as well. How did you respond as part of your organization or on a personal level as well? What was your reaction?
So in my university role, I think because I'm part of the university executive, obviously as a Deputy Vice Chancellor and a nurse, it was kind of automatic. Everyone just kind of said to me, what do we need to do? You need to lead this for us. And I think as a nurse, you become very confident at reassuring people and trying to use your skills in CAM. But inwardly, I was thinking, well, I might clinically know a few more things than you, but this is big. I don't really, I've never lived through a pandemic in my lifetime, but it was quite clear the organisation, like many, was in danger of that kind of widespread panic and anxiety. So at the very beginning, I spent a lot of time reassuring people around what they needed to do for themselves. So it was very quickly into the hand washing, you know, coughing into a tissue, putting it in the bin, coughing into the arm of your sleeve. Very kind of general public health advice for all. So we as a university were quite quick with messages to staff and students. This is what you will need to do, before a lot of the information came out around, you know, hands, face, space, and all that kind of stuff. And then within the council, we had started to say, look, we're here, we will work with partners across the 4 countries of the UK. And then meetings very quickly were established, very rapidly. There was daily meetings at one point around what the needs of the NHS were, what the modelling was showing, and very quickly an ask of universities to engage and support with students, etc. And that was a very, very difficult time, but one that was actually, you know, quite early on in the planning, but very difficult to come to some conclusions.
So do you think, did you have very much of a leadership role in there, or were you very support kind of role? Because you know, as a lecturer, what was your kind of like main aim? Did you want to lead the university and the Council of Deans in a way, or were you very supportive towards whatever was happening?
I don't think I had a choice, if I'm being honest. My role in the university is as a leader, as a Deputy Vice-Chancellor. And so the expectation was to lead. And if I'm honest, I knew I had to lead that. And so I was very quickly pulling people together. I remember we had an evening workshop, I think very early March to, it might have been the end of February. It was before lockdown, to say, how are we going to manage our business? What do we need to do? How are we going to put health and safety of staff and students first? So we're very quickly into conversations around working from home, how we're going to manage to transfer education online. But it was all in the dark at that time. We weren't really sure where the country was going to go, or what the asks were. And in the Council of Deans, it was very much there as a leader representing the university sector from a nursing, midwifery and allied health professional perspective. And it was very clear partnership working. There wasn't a, you will do this, I would ask is this. It was very much, what do we think we need to do? How are we going to manage it? What are the problems? What are the challenges? So working with all the chief nurses, the unions, the RCN, the RCM, and working with partners, and the level of partnership engagement and stakeholder working was probably like I've never seen before. People had a common desire to try and get this right. And how do you get something right when you've never worked in it before? It was really a challenging time, but the partnership working was just evident and very paramount.
So you kind of already answering my next question there. What kind of like a feedback, or what was the reaction of your fellow colleagues or students? How did they feel about the whole situation?
The university, my role in the university was quite hard actually, because there was quite a lot of panic, there was a lot of fear, there was a lot of anxiety, and there was a lot of anxiety among staff. And a lot of that's hidden from students. But we had, I was offering, very quickly put together a leadership team to manage COVID, a small team, and it very much was by command. You know, we say you do this, you have to do it. We're not going to discuss this till the cows come home. If we tell you you have to go from home and work from home, that's what you need to do. If we're telling you you need to wash your hands, you need to do that. But staff were hungry for information. People at that time, we didn't know then what we know now. And we started to see the media reporting on a number of cases, a number of deaths. And very, very quickly, there was a level of concern from staff around mental health issues. Students were a bit more ambivalent, to be honest. The level to cope with it was really encouraging, but people were worried about, well, what will the impact be on me and my studies? You know, we're a very applied university. We've got a huge range of health students, from nursing, midwifery, radiography, paramedics, physio, OT, social work, blah, blah, blah. education students, very practical, very applied. So the issues about, well, what happened to my placement, how am I going to manage to still learn, were very nerve provoking for the students. So we had a lot of reassurance to do. And that's in a time when guidance was constantly changing as well. And that meant you were in danger of sounding like you were giving mixed messages, but actually you were trying to work to guidance. Within the Council of Deans, universities, I spent long days, very long days with taking calls, taking emails from universities, say, I don't know what to do about this. Do I take my students out of practice? Do they stay in? What are we doing? So we very quickly again set up briefing sessions for deans of health, deans of faculties and heads of schools, and tried to answer questions. And that's very difficult when you're working in 4 countries where the systems are not the same and each is quite devolved, and you have to respect that and work with that. So a lot of it was around information giving, listening to questions that universities had, taking those questions back and trying to work through some of them with partners and colleagues and trying to come up to some solutions. So it was very much a facilitating and leading role at that time in the first round.
So I'm sure that must not be an easy task to do. Did it ever kind of keep you awake at night? Was there something or some moments that would just not let you, you were constantly like, there was no work-life balance at all. You're always like in that. Did it happen to you at all?
Yeah, I mean, gosh, I had many sleepless nights about the decisions we were making in the first lockdown around sending students into practice, and a constant fear at that time, well, how do I live with the fact if a student caught COVID and died? And you've been part of this decision to send students in. That was, I can't talk about it too much actually. It was kind of mind-blowing. And then at that time, we had a close friend of ours who died from COVID, so caught it and died within 2 days. So it was quite a really difficult peak time, that kind of April, May time of the first pandemic. So it was really hard. And I think the hardest thing was the constant media focus and attention, which I didn't think really reflected what was going on. So there was a lot of attention on ITU, critical care. There was a lot of attention on nursing homes, but the media never really portrayed what was happening in the community, what was happening in various roles that our professions working in various settings. It was quite a narrow lens, and that narrow lens, I think, has maybe distorted some perceptions. I think the other thing for me was the conversations on social media. And I do remember at one point that I just couldn't look at social media and kept my phone off, my personal phone off for many months actually. And for lots of reasons, it's very difficult when you're in quite senior Department of Health government partnership meetings and you're wrestling with colleagues around the best way forward. And then you're reading social media and people are slamming you for, why didn't you think of this? Who do you think you are? And, I remember one comment in particular, it was the comment that just tipped me over and said, that's it, phone off, which was, how could an academic possibly think that the right thing to do was send our students into the NHS at a time of this pandemic? Hadn't you thought about X, Y, and Z? And this was another academic, and I thought, but we've talked about all those things in the meetings. Of course, we've wrestled with those, but you're not party to some of those discussions. And because you're also an editor of a journal, you've got a huge following, and it was very, very negative. And I'm totally up for criticism. I don't get everything right, of course I don't. But that was quite hard. And I found for my own mental health, the best thing to do was switch off the phone, focus on the job at hand, be the best possible leader you can be, and keep reflecting on what you think you could do better and how you could respond differently, as you would in practice anyway.
would you say there were any priority issues, especially around student nurses? Because I know, especially at my university, there was a big concern about, will we have nurses at the end of the year, you know, because there's a constant cycle of like this many nurses leaving, so we need this many nurses. So was there any priority around those issues?
There was. I mean, throughout all of the discussions, the top priority was about, we know that COVID will come, and at some point, this is a long haul. We always knew it was going to be a long haul. You know, it's a message I still think that we need to keep reminding people of as things relax. This is still going to be a long haul. And if we just make decisions that impact on the here and now, we're not going to be thinking about getting students through programs, making sure they complete on time and can be part of the workforce. So there was always a goal around, we don't really want to do anything that's going to negatively impact on student completion. And that's why there were some differences to student nurses in the second lockdown compared to the first lockdowns, because we'd learned quite a bit from the first lockdown, and that's why a slightly different approach was taken in the second lockdown. And the biggest one being that, you know, you could use the time that you were in practice for your completion of your programs, whereas in the first lockdown, if you chose to go in on paid placement, you weren't able to use that time as part of your completion. And that seemed counterintuitive when students were working in a crisis situation. And the other part for me for students was making sure they weren't a forgotten entity within the NHS, that they did have access to PPE, that they were is included in all the health and safety considerations that any organisation would have, and think about that in relation to vaccinations as the pandemic moved on. So the priorities of students as learners and students still being able to be part of the workforce, and that they're just as an important part of the workforce as a student as to anyone else, for me, was my priorities.
And during the whole time initially as well, and then as we progressed onto Teams learning or Zoom learning, what sort of support was there for like students or the staff, you know, because not everyone learns the same way, and we just had to get on and do it. So was there any support around that?
So I think I can only answer from my own university perspective, because I think universities will have, there'll be nuances and differences, but as a university, we've never closed. We've always had our nursing students on campus. It's been slightly different because in skills sessions, clinical skills, we've had to have much smaller groups. So what it's meant is the academic staff have had to do much more repeat sessions to students. So it's been really tiring for the staff, and they've also had to really try and support students with mental health issues or academic issues in the online environment, and that's a real challenge for the student and for the academic. So most of, if I went out now and asked my nursing team, what's it been like for you, they'll probably tell me, I'm actually quite exhausted. It's been a really long year. The hours have been really long. And it's been a challenge trying to reach out and connect to people in an environment that maybe isn't always conducive to some of the conversations or issues that they might have. But you know, we've made a big thing about online learning, but university students have always had a virtual learning environment. So they're always used to accessing resources for that. We've maybe used it differently, and in some of that it's been really positive, and some of it is, no, we need to get back to some face-to-face now. So there's been good and bad, I think, but I think from the staff perspective, it's been a challenge, but from the student perspective, gosh, I would just applaud my nursing students, if I'm being really honest, because they've just wanted to get the best education, they just want to learn, and they just want to complete their programs and be registered nurses. And their ability and their resilience has been great. And when they've had bad days or negative days, they've been very good at putting their hands up and saying, I could do with a chat, I'm not in a good place just now. That's great. You know, couldn't ask for more.
So moving on to this topic is personally really close to me. So, you know, when I was seeing in news that the Black ethnic Asian minority people were affected more by COVID, or there were more deaths in that community, was there anything that you had to revisit, look at the emergency standard plannings, or, you know, the which student goes on what sort of placement? And especially I know there was red, amber and green at my university depending on your risk assessment. So how was it for you, just to be on the other side of, I think?
Yeah, from a university's perspective, I guess where we are in the very top of the Northwest, in the Cumbria region, our population of students from a BAME background is not very high, and that's just reflects the demographic of the city and the area. But we were very clear from the very beginning. The minute we realised that that evidence was coming out, we didn't want to think about it just from a BAME perspective. We wanted to make sure that any decision we were making was for all students, and it would reflect in an inclusive approach to all students. I guess what it did for me though was I did reach the point where I had a kind of an aha moment, you know, one of those things where you think, gosh, I've been so busy with work, with planning, with COVID, that actually I've not spent a lot of time connecting with friends. And I've got many friends who come from different cultural and ethnic backgrounds. I felt a bit of guilt actually, because I felt I'd neglected friends. And so I started to kind of reach out a little bit and talk to friends about how they were, how you've been coping with COVID and the pandemic. And I'm kind of listening and learning from them. And it was great because equally they were saying, well, actually, how are you? And I thought, actually, nobody's asked me that. And I think when I mentioned our friend that had died earlier, I kind of realized that I hadn't really grieved either. I hadn't really stopped to spend time and think about the impact of our friend's death and the impact on us as a community of friends and what that would mean. It just was, it sounds horrible to say, but in some ways it felt like another statistic rather than a kind of normal reaction to a friend. So mixed reactions to that question, Cyzel, if I'm honest.
There you go, I'm unmuted now. I think I definitely do resonate with that, because I did have many friends that just couldn't cope and decided that, you know, at this moment in time, my family, my life, or my health comes first. So I had to put a backseat. They're definitely coming back and starting a new year this September, but I know what you mean by like having those difficult conversations or decisions was very difficult. So just a couple of months ago, we had a year on kind of a commemoration of reflection and a moment to pause, I guess, in some ways. Did you do anything special on that day? How did you commemorate a year of struggle, I guess?
Yeah, I mean, as a university, we lit up some of the buildings with special flooded lights. I think we do that on occasions as a mark to our community of respect. So at Pride Month, for example, we'll light up our campuses overnight in rainbow colours, and we've lit up the campuses in blue in respect of the NHS with kind of hologram logos and all that kind of stuff. On a personal note, I did pause and reflect, but I wasn't one of those people that came out and clapped and banged my drums and all that kind of pans and all that kind of stuff. I just personally, I felt that was a little bit tokenistic because, you know, I've been a nurse my whole life. I left school at 17 and went into nursing. I'm 57, you know, I've been 40 years a nurse. I've got lots of friends who are still working very clinically and lots of colleagues in HE, and I felt just to come out and thank them by clapping for me wasn't, I don't know, it didn't feel that's going to help them in any way. And when I had that aha moment, I started to connect a bit more with my friends and ask how were they at work, how was it for them, what are they dealing with, and heard some horror stories and some fantastic professional resilience. You know, it was amazing. But I think for me, I still felt on the year on day, but we've still got a long way to go. We're still not over this. And now my head went immediately to what more are we going to have to be doing as a university for our students? What are the mental health issues going to be like? What are the what's the service that they're going to be like in the future? What's their careers going to be like? I think we've still got a lot more to do to support people post-pandemic, and I will give a lot of attention to that, not just now because we are doing that, but carrying on in the future. I think we'll have many years of post-pandemic issues which we'll have to deal with without being dominated by the pandemic, but recognizing the impact. And actually, what are we as academics? We're supposed to be really good problem solvers and think of solutions. So let's use our knowledge capital to work with others and support people. So that's how I've kind of dealt with it, which is probably people in this call might think, oh gosh, that's a bit black, but a bit dark and secretive, but that's how I've dealt with it.
I think at the end of the day, we all have our own ways of reflecting back, you know, like if it was, for me, it was just spending those 10 minutes or 1 minute, remembering what the year has been. So there's nothing dark about that, I can say at least. So we're almost time up with you. Any last words that you would like to say to all of us?
Oh gosh, I wasn't really expecting that. No, I just think, you know, as a nurse, it's hard to explain, but I've felt this before, and I've felt it as a patient when I've been a patient as well. But it's an unusual profession, nursing, because you have to learn to deal with things that other people will never ever see in their lifetime. But yet we learn to get those skills and to cope with those things. So if we as nurses think about the amount of people we've seen die or been seriously ill, or the impact that has, if you were to analyze that and think about it and get into a negative cycle, it will pull you down. But we do develop the skills to learn to cope with that and to lead. And from what I've seen in my own university and from a leader looking at across the country, you know, I just have to stand back and give credit to lots of colleagues, whether they're students, academics, or my colleagues in practice, because people have been fantastic in the way they've responded. The professionalism has been outstanding, and that will need to carry on going forward.
Well, thank you very much for your time and all the fabulous reflections you've shared with us today, Brian. I'm sure there'll be loads of questions coming in for later on.
Thank you, Cyzel.
So now we're going to have James, who will give a student perspective on how working during COVID pandemic has been, I guess. There you are, James. Well, are you ready for my speed round? I hope that doesn't go too well. Fast, I meant, not well. Oh my God. I just realized what I said then. Okay, so what was your very first memory of COVID then? Did you have a specific moment, or when did you realize that, well, it's going to be a year of 2020?
Well, I suppose it depends where you are. As Brian said, you know, Brian perhaps had a bit more notice than I did because of what he was involved in. I was at home. I study in Liverpool, but as you can probably tell by the voice, I'm from Northern Ireland. I was at home on leave from study at the time, and in around sort of February time, I remember seeing the news reports and things. This pandemic was starting in China, and we weren't calling it a pandemic yet, but there was a bit of worry. And having worked in healthcare for a while, I do like to read the news. I do like to watch the news. I was seeing some reports coming in, bits and pieces. Really, when COVID started, as it started to seep in England, I was one of the first people sort of in my area back home in Northern Ireland. I got it very early in late February. I caught COVID in a healthcare environment. and was off then for a couple of weeks. So very quickly, my memories of it jumbled. Very quickly, it went from, seeing the odd news report to someone telling me, I think testing was only just in place for healthcare workers when I caught it and was then tested and told I had it. So one of the first memories I had was actually getting COVID, and that sort of initial panic of, at this stage when you catch COVID now, you're not as worried in a sense, because you probably know people that have had it already. There's vaccines out there, there's testing out there. Sort of when I got it, didn't know what it was. There was a bit of panic around it. So I think that would be one of my first memories, was the very quick flow within a few weeks of seeing the initial reports to actually getting it. I don't think we were actually even in lockdown yet when I contracted COVID. I think the lockdown started while I was isolating. So it's interesting from that point of view.
Absolutely. And I think that's one day I won't forget. It was March 23rd, 2020, we went into lockdown. And like you, I had COVID way before we went into lockdown, or COVID even was something that everyone knew. I lost my sense of smell for a month, and we didn't even know that was one of the signs that you had to look for, a symptom. And it's so crazy just to look back and be like, oh my God, I'm still here, even though I probably was one of the few very first to get it. So definitely something personal to connect on, I agree. So how did you, or your organization, when I mean organization, your university, or you said you were at a workplace, how were things changing? What were their response, like PPE, social distancing? What was happening?
Well, I suppose there are two ways to look at it, and I'll try and cover both in a short space here. I was, as I say, I caught COVID very early, and I was working in a nursing home, and I contracted from patients before PPE was in wide use, before the lockdown. So I was then off for just over 2 weeks, isolating. And when I was told by doctors and took a bit of reassuring that it was not infectious, because we didn't know the full ins and outs then, I returned to the workplace to find that. And at the start, I think care homes were very badly hit. I know that was particularly the case in Northern Ireland and throughout the rest of the UK as well. So when I returned, I found an environment where, there was 20 odd staff off sick. There was 40 odd patients infected with COVID because it was a dementia nursing home environment. It's one of the environments where containment is very, very difficult, and I've seen that be the case in the NHS and mental health environments too, that when a patient doesn't understand isolating, when they don't understand that there is a pandemic, you can't enforce it. Unfortunately, it's not practicable. So when I returned, it was into a straight sort of, it had already hit the fan when I got there, sort of as the way you would describe it. So immediately changes had to be made. When I was, before starting my degree, I was a senior care worker there, and I was put in to help lead the care team with a couple other staff. Although it was mainly, most of my care team was sort of redistributed workers from the NHS at that point, because most of the staff that I had under me in the nursing home were out sick. So it was an extremely hard experience to go straight in and to be. I imagine it would have been more serious, but similar in some of the ITU environments in the hospital. But I think the main thing for us was we were going in and we were very much, care homes were very isolated at the start. So it was, you were in there and it was, what do we do here? We don't have doctors on site. We can't pull staff from another ward. Hospitals are already in crisis. What are we going to do here? And it was that very, very quick change of taking a sort of leadership role with the volunteers that were coming in, with the replaced staff from the trust, and saying, look, this is what we need to do. This is how we need to care for these people. This is how we need to care for these people. And then I was taking more of the role of going around and doing more of the nursing duties of these are the critically ill patients. And that's, so it became very much from going from an environment where it was people's homes, it went very quickly to, I'm dealing with critically ill patients. What can I do to save the maximum number of people? And it was a very upsetting experience, but that's where we were at the time, unfortunately.
So you kind of already answered your role as a leader during those times. But did you feel like you had to take on a leadership representing the student body as well?
Well, yeah, well, after I was in the nursing home, but this was before students were asked to opt in. So when students were asked to opt in, I initially said yes, and then delayed until the outbreak with the nursing home where I was working in was dealt with, and I could be tested and etc. etc. But there was a place for me on a ward, so I then travelled to England because that's where my university was, and that's where I had to go to take part there. And I did try that. That was sort of when there was a lot of confusion among students, and I took on a role as I didn't yet have the role in the Royal College of Nursing. I was a student ambassador, but it wasn't on any committees. So I took on a more active role then of, being in contact with the university, trying to help other students that were in the same clinical environments as me. Just trying, because we were very much without information. People were scared. People were scared about going into practice.
Yeah.
People were scared about, were they going to finish their degree? Was it going to be delayed a year? If they didn't go into practice, were they going to be removed from the course? There was a lot of panic around different elements, and it was very much, what I tried to do was very much reassuring people. I think especially the fact that I had already been in a clinical environment with COVID, a lot of people wanted to talk to me. A lot of people felt reassured, speaking to me a bit about what it had been like, and that I was all right after being in it. I think it reassured them about going into some ward environments. And then again, it was about making people feel comfortable if they didn't want to go into ward environments. It was making them feel comfortable that, yes, you'll be fine in your studies. You have to put yourself first sometimes. You have to think about it. If you don't feel safe, if you've got a family member at home that's high risk, don't do it if you're not comfortable with it, because your studies can go on, and even if they are delayed a year, they're delayed a year. We'll get past that.
Absolutely. I think to just give a different perspective on that, I was in my first year and we were just told, well, you can't do anything, you just have to stay home and continue with your studies. And it did feel like very much when I went back, mainly, especially after the first lockdown was over, we went back on placement and everyone was like, well, this is how we do it now, and this, like PPE and everything. But well, I didn't have much of a healthcare background. I didn't work in a healthcare environment. All my experience came from placement, and I felt really like out of place kind of situation compared to someone who had gone through treating patients one-to-one with COVID, whereas you can call it fortunate or unfortunate, I've not worked with anyone in a COVID ward, so I found it quite interesting just to know from others like what it has been like. So how did the colleagues or students, how were they feeling? Was there a high anxiety levels? Did everyone feel like, well, this is it, we need to face it? How was it for you and others?
I think in both. Because when you're a student, you're working with other students, you're working with colleagues. When I was back in the nursing home, it was all colleagues. But everybody was very much feeling the same thing. We're all under high pressure. We're all in a very difficult environment where it was difficult to deal with, especially in a nursing home environment, because you'll hear a lot when you're nursing in certain areas, and when you're a student as well, you'll get lectures on maintaining boundaries and stuff. But in a nursing home environment, the people live there, it's their home. And to a lesser extent as well, and when you're working in mental health and you're trying to foster those relationships, which is what I do as a student, you can't maintain, but you do maintain boundaries, but not quite to the same level as what you might do in a general ward. particularly in nursing homes where you do become friends with patients and their families. And, there was people there that I had nursed for 5 years. There's people that I knew in the community before they'd come in. I was friends in school with some people with their grandchildren and things like that. So it was a desperately hard thing for staff in those environments to be losing patients as we came into the pandemic, because it was similar to losing, it was like going in and losing. We lost about where I was working in the nursing home, about 17 patients, I think. So it was the equivalent to losing 17 friends, 17 long-term people in your lives, in a very quick space of time, in a very unexpected way. You're prepared to deal with death as a nurse to some degree, but not to that degree.
Yeah, and do you think that really affected you, or did you did you build your resilience, I guess, in some ways, or did it keep you awake at night? In simple terms, was there something that didn't let you sleep, that was always on your mind?
Well, yeah, I think at the start, I lost a close family member in the opening stages of COVID-19 as I was working in the nursing home. So it was a difficult thing. Like so many other people around the country, I couldn't go in a hospital and see them. I couldn't keep in contact with them. It was the hospital was having to deal with my daily phone calls, my 3 times daily phone calls, and which I felt guilty about, because working in a hospital, I know it's like to be on the other end of I wish that fella would stop phoning when we're trying to work. But I understand the family point of view too, because I'm one of those family members that might do that when you can't get in. So certainly worrying about people kept me up at night and kept other staff up at night. And you had critically ill patients, and you were going home and you were thinking, oh, their family can't be with them. There was a couple of stages where I got up, where staff had phoned, if I was a key worker for a patient, staff had phoned me in the night to say this patient is deteriorating. I had asked them to, and they'd phoned me during the night to say this patient's deteriorating, and I had went back in to sit with them, because we had sort of the standing orders that people were going to die on their own if their family members weren't able to come in for whatever reasons. So there were a couple of occasions where I was up during the night, not just worrying, but I was actually back into work, sitting with people, and that definitely weighed heavily as the pandemic went on. I think I did build resilience. I think I'm the type that sort of puts everything to the bit, because there was so much work going on. I think that did help me in a sense with grief, that I was focused on, there are people here that can be saved. We're going to go out and do our work and see what we can do here. But I think as things calm down, certainly that weighed more heavily in me. I did see the other hand of the where staff were breaking down in work, where there was a bit of crying, and we try to work together as a team, and as in any clinical environment, you try to work together as a team and support each other. But it's a hard thing to go through with it being so unexpected.
Absolutely agree. So did you feel supported, or were you offered any help after the experience, when it calmed down a little, I guess?
Yeah, but I think initially during the opening stage to COVID, we weren't prepared for that. There are certain elements to assist staff and to assist students, and I think they have certainly been bolstered during this pandemic. And I think that's one thing where, moving forward out of the pandemic, as we recover, those strengthened services will stay in place, where students are better supported. And that's one thing we can look at as a small positive note, that people really have built up resilience, and there is a bit more support out there, and really has brought the sort of nursing community together a bit more. As it moved forward, I felt, there was times when you'll feel a lack of support. There's times when you're out in clinical environments and you can't get university on the phone, you can't get this one on the phone, and you know, the pressure will build up. But I think that's the times where you sort of band together as a team, where you band together with other students. And I certainly feel as it went on, you know, as we passed the sort of, as we get further into the first lockdown, there were more support services, you know, trusts developed their own to help staff cope, and universities that already had services strengthened those services to allow students, particularly those, I know particularly in my own universities and others in the Northwest, they strengthened those especially for healthcare students, because we were feeling some of the worst of it, you know, being in clinical practice at the same time.
So we've learned so much over the last 18 months. Would you agree? And what is something that you think we really need to lock in this learning? We need to take this forward, see where we can go with it. Is there anything that you could think of in those aspects?
I think there have been, there's lessons learned during the pandemic that'll strengthen the profession and strengthen students. And I think certainly students that have been learning at this time have an advantage of having gone through this pandemic. They will have acquired knowledge. I know I've acquired knowledge that I certainly would never have got just completing the course normally. And so there's no doubt in my mind of that. I think the real lessons we've learned is particularly around infection control, around resilience, around mental health, and the support we need to provide to students and staff. You know, that's one thing I've been working on in the past year in my role with the RCN Student Committee within the Northwest region. It's providing a bit more mental health support to students and showing them especially. And I think from being in those high pressure environments, we have to realize where our own breaking points are, because it's very hard, and I know it is, because I'm quite good in recognizing in other people as pressure starts to build, but I'm not as good at doing that with myself. And I think it's the same for a lot of nursing colleagues. And it's that you have to realize when, you know, when you're on the ward, your pressure sits about here, then it gets to here, and this is where too much, it's blown off the top. You need to recognize when that's steadily building, when you're becoming more irritable, when it's getting too much. And I think it's about other staff recognizing that as well, because I know myself, you know, there was times working in that nursing home, working in the wards, where it was so busy and people were so critically ill, and the pressure levels were getting higher and higher, and I was running from patient to patient to patient. And it did sometimes take somebody to say to me, look, James, take a minute, breathe, calm down, you know, you're getting flustered. And I didn't realize it myself, but I was. And as soon as I centered myself and thought about it, I was. And it takes those couple of minutes, go get a drink of water, you know, go out and take the gear off and get a breath, come in and put the gear back on, you're centered again. And sometimes it's that resilience and recognizing yourself getting towards those pressure points and where it's becoming too much.
Absolutely. On the other side, as a student, you know, the nursing education, you definitely agree with me, you know, it completely changed. Like the first few months of being face to face, learning in a big lecture hall, what was it like going online? And you know, I personally didn't even have a desk at that point, so I was on my little table. How was it for you then, when we completely changed everything?
Well, I had just completed my first year in normal studying before the pandemic started, so it was a big change to come in and be straight to you know, and sort of at the start when we were deployed in the clinical environments, there was in a sense no learning from the university for a lot of us. You know, we had the university sending messages of support and sending this and sending that, but it took a while to get services into place to deliver all that remotely. And but that did happen eventually, and it is working to a degree now. I will admit I'm not a big fan of online lectures. Some people are, some people aren't. I know we're probably looking at a more mixed format moving forward. I think certainly a thing that needs to be remembered is there are people that I think something that was overlooked at the start and is starting to come into view now in terms of education is there's people with dyslexia, with ADHD, with learning difficulties, and the support we give those people is tailored around being in a lecture hall. And that was something I thought was needed to be looked at more as we were going through. I'm dyslexic and dyspraxic myself. So any support that had been tailored towards me was for a lecture hall. Now mine isn't as bad as what a lot of students would be. So it didn't affect me as much as what it might have had a lot of others. A lot of others will have felt it a lot worse. But I think certainly it was about getting that support and getting a wee bit extra support in for those students and seeing how they can be helped. And universities have adapted to that well moving forward.
Absolutely. I do agree on that, because I personally have a very short concentration span, so I need to have something interactive going on, or really be focused into something. In a lecture hall, you don't have any other option, whereas at home you're like always hungry. What can I eat next? So that was definitely something I struggled with, I guess. Thank you very much for all your honest answers.